All right. Hi, Marie. Thanks for meeting me today. Can you introduce yourself?
Yeah, my name is Marie Grob. I'm a registered dental hygienist. I have several degrees that do not pertain to dental hygiene. I have a bachelor in fine arts. I have an associate's in illustration and design. And then by doing the dental hygiene program, I ended up with three associates. So I have an associate's in dental hygiene. I have an associate in allied health and in biology. And I graduated in May of 2022.
Very nice. So, you work in a sedation dental office. So, what do your day-to-day job look like for you in that type of office?
Yeah, I think it's important to note that it is an office that offers sedation, but
Okay.
not every case is sedation.
Okay.
And what we do is oral sedation. It is mostly for patients that have very high anxiety in terms of the patients that I see. I do work for an office that does a lot of surgeries, a lot of implants, a lot of all on X dentures. So patients getting all of their teeth extracted and then having five implants on the top, and the denture attaches to the implants. It's pretty intense to go through that surgery. Most people don't want to go a long time without having teeth. So the dentist does do a lot of procedures where patients come in, they get oral sedation. So we don't do an injection of anything, it's medication that is given. And the person is still conscious, but then they are very mellow, very relaxed, and they don't remember anything. So to them, it's they come to the dental office, they take medication, they fall asleep, and they wake up at home. So for me, the majority of work that I do that involves sedation are deep cleanings or SRPs. And so I have 2 hours with a patient, and in those 2 hours, I do as much or as little as I can, depending how much tartar they have. So because they're sedated, we try to do as much as possible. Usually for a deep cleaning, you try to do only half mouth.
Okay.
Usually it's for patient comfort. You don't want them to be numb both sides, especially if you do injections that numb their tongue. It's
Mhm.
kind of, it's not that dangerous, but it is dangerous for someone to not feel their tongue at all. And then they could chew it and all of that stuff. But then also insurance, which is a big obstacle in terms of giving dental care, a lot of the times doesn't approve doing two sides in one sitting,
Okay.
because then they think it's like it's not really a deep cleaning. There's not enough there to justify a deep cleaning. Um, yeah, but in those 2 hours, I have to monitor my patient. We have a constant blood pressure monitor. And so I have that going, and we check also the person's blood oxygen, because when you're very relaxed, your tongue can kind of go back into the back of the mouth and prevent breathing properly. And so if that's the case, then we pull the tongue forward. But it doesn't change much to how the cleaning goes, because I can still talk to the patient. So a lot of the times they're sleeping or they're snoring. If they sleep with their mouth open, it's great because then I just have full access. A lot
Mhm.
of people tend to like try to turn away, or sometimes because they don't really know what's going on, they try to push your hands away. So you have to be a little bit more aware of what's going on. And then it can be harder to move their heads, right? You'll be asking, like, hey, can you move your head? And sometimes they don't listen, or keep your mouth open. So we use more bite blocks and special suctions and stuff like that just to make the appointment go better.
Okay. And is this all like sedation dentistry things you learned in dental hygiene school, or are they sort of special skills you had to learn for this job?
Yeah, you in my program, and I forgot to mention that I graduated from California. So my school was Diablo Valley College in the Bay Area. Um, there was nothing about what to do for sedation specifically. You do talk about sedation because you have to know how medication works. So it is part of your pharmacology class, I believe, and you go into the different kinds of sedation. So I was already familiar with how sedated the patient is and all of that, and also the possible complications to someone getting sedated. But otherwise, you do a class on special needs populations, and that includes anything from pregnant women to people with autism.
Mhm.
And so, some of those things that relate to other types of patients also relate for someone who is sedated. So you do end up having most of the skills or at least some knowledge, but nothing quite prepares you like having to do it.
in real life.
Yeah.
What do you find the most challenging part of being a dental hygienist?
I think there's two things. One is the toll it takes on your body, even being just 2 years out. I'm lucky because I also have a posture therapy certification. I was a posture therapist for a while and a yoga teacher. And so I do know a lot about ergonomics and all of that and being able to counter what's going on, what type of chair works, and all of that. But even if you do all the right things, it's hard not to have some aches and pains. So it's hard on the body. And then in terms of the work itself and like your day to day, what brings stress, it's time management. And especially when you just come out of school, because in school you get like 3 hours with a patient, and then you have to be able to do everything in less than an hour, because in that hour you have to turn over your room and write your notes.
Okay,
Yeah.
all right. What were the biggest barriers or obstacles you faced sort of getting into dental hygiene school or during dental hygiene school?
Getting into dental hygiene school, I got very lucky. I went back to school, and because my degrees were all older, I had to redo everything. So I felt like for me, a barrier was kind of like time. I was 30, 31 when I went back to school. And so I was like, I really don't want to redo all these classes. Um, and I had to redo everything. My bachelor's is from Canada, and they did not accept any of my stuff. Like the English, they were like, oh, it's foreign English. And they didn't take it. So I had to redo college level English. I had to redo intermediate algebra because you need some type of math. I had to redo a nutrition course, which I had done during my bachelor's as an elective. So I had to redo everything from scratch. Um, so that was one of the barriers. Luckily for me, I'm married. So in terms of finances, I was fine. My program was through a community college. So it was not expensive. And I got very lucky. It's a lottery system, and I got in my first try.
That is
So I got,
nice.
yes, I got very lucky. And during the program, I started my program in May of 2020
Okay.
in California. And getting patients during a pandemic is
Mm,
extremely difficult. It's difficult to get patients already. And my program, you had to find 100% of your patients.
yeah.
So that was a huge, huge challenge for everybody in my class.
Yeah, I bet. Um, what was the most important factor for you to be successful in dental hygiene school?
Support in terms of I'm married, I'm lucky. My husband was there for me. And so when there were times where I didn't have time to do anything, he could help. And also having people around you that are understanding when you have to cancel plans, because it turns out the test is next week and not the week after. Yeah. And then I was lucky that everybody in my class, because it was during the pandemic, kind of grouped together and
Yeah.
helped each other out to keep each other on time and like remind people of deadlines and all of that. So we had like a forum online that we were all on, and were able to like discuss things and help each other out if we had questions.
Okay. So you like created a little community within your class.
Yeah, because we were not allowed to talk outside of class on campus. We had to wear N95s the whole
Oh,
time. All of our didactic classes were online. And then we went to clinic, and you have a full day of clinic in this program. And so you have to have your N95 before you walk into the clinic. And then if you take a lunch break, you cannot have lunch with your classmates on campus. So everybody was kind of eating lunch in their own cars. So it made it very difficult to help each other out in person,
yeah.
etc. So it was nice that the first kind of Zoom meeting we had, we set up this area to be able to chat.
Very nice. And what advice would you have for me starting dental hygiene school?
I would say it's really hard for a hygienist because usually we're all the same, but let go of perfection. A passing grade is a pass. You do not need an A in anything to be a hygienist, and everything that you learn in school is great, but there's computers and things to look stuff up if you can't remember something. So don't put the pressure on yourself that you need to like retain 100% of everything. Passing is fine. You're just going to make everything harder if you're trying to get a straight A's. The person that gets the best GPA in the class and the person that gets the lowest GPA in the class is going to get paid the same.
That's good advice. Right. Well, I really appreciate you sitting down with me today.